right. Good morning.
Good
And it's almost
morning.
nice to see rain today, isn't it? It's been such a long time. I want to welcome you all to our United Way Town Hall presented by Women of Tocqueville. I'm Susan Dunn, and with me is Paula Gilberto. And not only are we proud to be part of today's town hall, we are also proud to be past CEOs of this United Way, longtime Tocqueville donors, and co-chairs of this organization's newest membership group, Women of Tocqueville. Many of you are here today as part of at least one United Way's membership groups, which include Tocqueville Society, Constitution Society, Women United, and Emerging Leaders Society. Welcome and thank you. United Way's membership groups provide an opportunity to bring like-minded philanthropists. Doesn't that sound fancy? But when you give, you are a philanthropist. Brings us together to make lasting change in communities where we live and work. Interestingly enough, and I could go on and on about this, but I will stop myself. The Tocqueville Society is named after 19th century French political thinker and historian Alexis de Tocqueville. He traveled in the 1830s through our developing country, our new democracy, with his friend. And it was kind of a road trip for them. They were wealthy nobility, didn't have much to do, decided to come to America, and he actually ended up producing some amazing volumes about what was going on in this experiment in the United States. And one of the things he noticed was how people came together willingly to help each other, which was something that didn't happen in Europe and in France. So he really was the first to say how this idea of philanthropy, working together, helping your neighbor is uniquely American. This is our Tocqueville Society, and you can see why we're named after Alexis de Tocqueville, is dedicated to developing a stronger sense of community and connection among local philanthropists through engagement opportunities that grow awareness of the issues and solutions affecting the well-being of children and families in our community, and networking with people like us who care. Not only is this local, is this work, but when you're a member of the Tocqueville Society, you're actually part of a national society, not only national, but international, of, again, people, philanthropists, who are working to make their community a little bit better. Our newest membership group, Women of Tocqueville, creates a connection between the strength of our Tocqueville Society and Women United to create an opportunity for women in philanthropy to connect with experts in our region and rally together to take action in our communities, just as we're doing today. Paula, I'm going to turn it over to you now to pick up about Alice.
Well, thank you so much. And Susan, you've done such a great job in terms of all of the connections that women have and what happens and how powerful it is when women come together. And so Susan and I just couldn't be prouder to be founding members of United Way's Women of Tocqueville and to co-chair it and to grow it. And I think the real piece here, for me anyway, and perhaps for many of you, is that it is about purpose, and it's about purpose driven. It's about our values. It's about what we believe in. And I think it's also about the power of what we can do when we come together for a common cause. And in this case, United Way's Women of Tocqueville, we are dedicated to helping all of our neighbors in need, and also the families, the individuals and families that are struggling to make ends meet. And thanks to our colleagues at United Way of Northern New Jersey, we can put a name to so many that are unknown to us, but we know either from our own family experiences or the experiences of friends exist. And that name is Alice, asset limited, income constrained, and employed. So what can United Way's Women of Tocqueville do? Well, we have an opportunity not only to build incredibly strong bonds with other like-minded philanthropists, but we can share wisdom, service, and generosity, all in support of helping women, families, children to succeed, to prosper. So we do provide an opportunity to deepen our knowledge of community issues and connect you with experts in the field. And today is one such opportunity as United Way's Women of Tocqueville proudly presents this town hall, Alice in Action. This is a really important conversation, not only to raise awareness about the trends affecting working families in Connecticut, but also what we as a local United Way can and will do to make a difference. We have a great agenda for you today featuring experts on data, on social issues, and also critically ways to make a difference through our philanthropy and through our engagement. So let's get into our program. Our first speaker, Dr. Stephanie Hoops, director of the ALICE Project at United Way of Northern New Jersey. And Stephanie, just bear with me. You have this incredible background and resume, and I'm going to cover the highlights because everybody should know what an incredible expert you are and how grateful we are for you and to be here with us today. So Stephanie has overseen the expansion of ALICE from a pilot study of low-income community in Morris County, New Jersey, to now a national effort with ALICE data for more than 3,000 US counties. Stephanie, your research has garnered attention locally, statewide, national media, and legislators. Before joining United Way of Northern New Jersey, Stephanie taught at Rutgers University, Newark, and Columbia University, and at the universities of Sussex and Birmingham in the United Kingdom. Stephanie has a doctoral degree from the London School of Economics, a master's degree from the University of North Carolina at Chapel Hill, a bachelor's degree from Wesley College, and received a resolution from the New Jersey Assembly for her work on ALICE in 2016. And I just have to tell you, Stephanie, I feel like a real slouch. But I am grateful that you are here with us today, and we're turning the agenda over to you.
Well, thank you so much. It's a real pleasure to be here. We are just celebrating Alice's 15th birthday, and
Wow.
Connecticut was one of our first state partners. So you all have been with us from the beginning, and it really means a lot to be here and to share in your mission to put this ALICE data to action, because that's what it's all about. And having this wonderful background in academia, not so much happens there. So to be able to bring this rigorous methodology and research to folks on the ground who know their communities, are doing the work, is so meaningful. So yeah, I'm excited to tell you a little bit about the national perspective, and then I think we're going to dig into Connecticut's data as well. So this is what it looks like across the country. So just if some of you all are new to ALICE, briefly, we have kind of two ways of looking at ALICE. One is the technical definition. ALICE households live above the federal poverty level, but below kind of that bare minimum to live and work in the current economy. So nationally, 13% of households are below that federal poverty level. So that's our official measure of financial hardship. But when you look at what it actually costs to live in every county in the country, another 29% of households are ALICE. And so instead of it being 13%, it's 42% of households are facing some kind of financial hardship. And that is a different magnitude, and it's going to require a different mindset and a different set of resources to change that. ALICE lives in every state in the country, lives in every county in the country. And I thought you all would be interested to see where Connecticut ranks. And you have about the 20th lowest rate of financial hardship, with 40% below that ALICE threshold. And this graph, I think, sums it up. For me, looking at that gap between what the household survival budget tells us are the minimum costs of housing, childcare, food, transportation, healthcare, small technology, and then ALICE pays taxes. So that's the blue column. The yellow and the blue column is for a family of 4, 2 adults and 2 children in childcare. The yellow column are 2 of the most common occupations in the country, retail sales and cashier. So 2 adults working full-time year-round don't earn enough to afford that budget in the place where those jobs are. And so that's a really important thing to think about. Like we need these folks to help run our economy. And then this is what it costs. So it's this mismatch. And the other way of thinking about Alice, we have the numbers, but we run into cashiers and retail sales folks all the time. We run into Alice workers 5 times before you even get to your job in the morning. So think about dropping your child off at childcare, getting a cup of coffee, going to the bank, the security guard at the parking lot. So Alice is very much part of our economy, but Alice is also part of our families and our neighborhoods. Many of us have been Alice. My kids are struggling and they're just out of college, trying to afford housing where their new jobs are. It's a real struggle. Many of us have parents who are retiring without the savings that they'd hoped. So we see Alice in many parts of our lives. And then to put this all in perspective, so we got the blue column, the yellow column, the gray column on the right is the federal poverty level. And it's so low and almost irrelevant today compared to what those costs are. And that number is the same number in Connecticut as it is everywhere across the country. So it's really not reflecting the current economy or the huge variation in the cost of living. And many of the counties in Connecticut, the cost of living is so much higher than think of places like Mississippi or Iowa, so not able to take that into account. Oh, I think we need to go the other way. Great, thanks. So this is looking at poverty and Alice over time. And what really stands out to me, and it's very important for our country to recognize, that the poverty rate has been pretty flat over the last decade. So this graph shows from 2010 to 2022 with a dotted line out into the future. The middle blue line are the Alice households, and we see that number ticking up through the Great Recession, through the recovery, into the pandemic, the post-pandemic, and through Republican and Democrat administrations. So what we're doing as a country as a whole is not changing that trajectory. Part of the problem is the focus has been on the federal poverty level. And if folks are seeing, okay, well, that's not getting worse, what we're doing is holding that up, maybe things are okay. But it's not taking into account that the number of Alice households is continuing to increase. So as you all are thinking about action today, think big. What is currently happening is not enough, and we all need to participate. It's not just the government's job, it's philanthropy, it's companies, it's academia. There's a role for everyone to play. And this is a recent tool that we've developed called the Alice Essentials Index, and it measures the change in the cost of the goods that Alice buys. So the things that are in that household survival budget. And then we compare it to the Consumer Price Index, which is the measure of all the goods and services that people of all incomes buy. So that's the dark blue line, and the yellow is the Alice Essentials Index. And we see the cost of those basic goods increasing faster than that consumer price index. And that's important because the full extent of what Alice's challenge is not being captured by another federal official measure. And so even though we're seeing some wage gains, which we have, and for the first time in a long time, wage increases for low wage jobs, but it hasn't been enough to catch up to the increase in the cost of these basic goods. So there's Alice working really hard. I think of it like running up a sand mountain, as fast as you can, and, working a job, working a side hustle, thinking you're getting ahead, and then you slide back down when you get to the grocery store, when your rent increases, that those costs just make it so much harder to ever get up the top of that sand mountain. So to leave you with a few ways of digging in further, I wanted to share a couple new tools that we have on our website unitedforalice.org. So the first is our income status tool, and you can use this in a couple ways, but go in, pick your state, pick your county, your household composition, and it will tell you the household survival budget for your location for that family. If you have a family that you know the income, the tool will tell you whether that's income is above or below that ALICE threshold. So very useful if you're trying to do, programs where you want to target a certain household combination, if you're trying to determine what should be that eligibility threshold, if you're trying to create goals for different programs. So easy to use, and you can, at a few fingertips, get some quick answers. And then with the focus on action, with this town hall, I wanted to share that we have an ALICE in Action database where all kinds of examples of that ALICE research in action across the country. And you can filter it by geography, by topic. So if you're interested in housing, you can call up all the examples of housing. You can also filter it by the year, so just see what's happened in the last year, or if you want to see things that have been going on since the beginning of the project. So super handy, and wanted to highlight that for you all. And then one more, if any of you all listening are ALICE, or you know someone who's got a really good ALICE story, we're trying to collect those and share them back out to help give ALICE a voice. And literally that's what we call it, ALICE Voices. So alicevoices.org, you can go in, record your story, your segment, and we share it back out. So if y'all send in some from Connecticut, we share them back out with Connecticut, but we also share them across the network, because it's really powerful to hear just how many different ways ALICE is ALICE, and it gives everyone courage when you hear folks speaking up. And I do want to mention that ALICE is speaking up. We have some great voices that you can also listen to on the website. And we also saw ALICE voting. ALICE accounted for about a third of the electorate, according to exit polls. And so I think it's important to know that ALICE is out there advocating, and it's important that our data is nonpartisan and available to all leaders, all politicians in government, but also leaders in other parts of our community as well. So it's important for all of us, for ALICE to do better. Our communities are stronger, our economy can grow, our whole society is better off when ALICE is better off. And the last thing I wanted to share, we have our National ALICE Summit coming in January of 2026 in Miami. It's our second one. The first was in New Orleans last year, and it was fabulous. A great place to learn what's happening across the country, meet with your counterparts from other states, and share best practices, goals. There's a lot of collaboration happening and so much inspiration. The panels are going to be fantastic. Great examples of ALICE in action, United Ways working with our community partners. So all kinds of folks will be attending, and we would love to have you all from Connecticut join us. And with that, I'm going to turn it back to you.
Thank you. Thanks so much, Stephanie, for being here with us today and sharing some of the national trends. I'm going to get into the Connecticut trends now, but are there any initial questions before we move on about the ALICE project overall? Okay. Great. So I'm very pleased to be able to share our Connecticut trends for our most recent report, which Connecticut United Ways released back in October for our state. So this is an update that was done in partnership with the ALICE project to take a look at how are people faring in our state. And so I'm going to walk through some of the key trends and data points that we saw in this most recent report. here are a few of the key trends. So 38% of households are living below the ALICE threshold here in Connecticut. We have a growing number of families in our state that are facing financial hardship. And that, as Stephanie pointed out, especially here in Connecticut, the mismatch between wages and the cost of basic essentials continues to grow and create challenges for individuals and families in our state. So you heard Stephanie talk about the ALICE household survival budget and the ALICE threshold. So for Connecticut, this is our household survival budget. This is what it really looks like, or what it takes to make ends meet in Connecticut. And I'm really proud that I've been a part of our United Way since our first ALICE report. And this report has been really useful to us, to our nonprofit community, to our partners in government, to just really understand, what does financial hardship look like in Connecticut? What does it actually cost to make ends meet here, and how many families are not making it? So when you look at this household size of 2 adults and 2 children, we use that. And when we talk about ALICE and this family size, we talk about young children, right? Pre-kindergarten. And that's because that's the most expensive time in a child's life until they go to college. And so this budget is based on that. So if you take a look at our threshold, and this is for 2022, our ALICE data is usually about 2 years behind, right? We use a lot of various trusted sources to pull this research together. And so we always want it to be apples to apples. So for the survival budget, we're looking at what it cost in 2022 for folks to make ends meet. And so you can see that equates to $57 an hour, or $114,000 a year for that family of 4. And you can see that in the breakdown of the monthly budget, this is really the basics. It's what we all just need to get by, to do our work, right? To have good care, good quality care for our children. Something else that I think is important to note here in Connecticut is that typically housing and childcare make up more than half of that survival budget. And we continue to see that challenges with rising housing costs are really affecting our families here in our state.
Hey, Maura,
Yes.
That statistic of 38% below the threshold, is that, does that correlate with the two adults, 2 children of kindergarten age, or is that of all households?
Also includes single adults, other household types.
Okay.
Yep.
Okay, got it.
Yes. We just typically use the family for the budget, right? Because it's the most relatable. We do have a single adult budget as well. And it is inclusive. And I'm going to talk a little bit more about actually who is falling under that threshold here. So what Stephanie said earlier, right, about the federal poverty level is really important, especially for us here in Connecticut, where we are a state that has higher cost of living, for us to just be aware of the kind of mismatch that is created. So the federal poverty level is a national standard, right? It's updated periodically, but not frequently, certainly not as frequently as we take a look at the ALICE data. And really, it has become an insufficient measure for us to say, this is what what it means for a family to really be struggling financially, right? Because we have different factors state to state that affect families' financial stability. And you can see here that the gap kind of continues to widen between what that federal poverty level looks like. So for that family of 4, they are considered living in poverty if they're earning $31,000 a year, right? Or $16 an hour, versus the ALICE threshold. People who we're saying, based on all of our data, are not able to make ends meet, are at $57 an hour and $114,000 a year. So when we talk about people who are living below the ALICE threshold, that includes people that are really living, who are ALICE, who are working but unable to make ends meet, or kind of living in working poverty. And then people who are working, but they're earning less than that $16 an hour. You have people who are struggling, right, financially, who are struggling to get quality jobs that allow them to pay to earn a living wage and who are in an even more extreme situation, who are living below that federal poverty level of $31,000 a year. We're seeing this a lot with our young adults in the city. A lot of the initiatives that Eric will talk about that we're working on, we're seeing barriers, right, to employment. And while, maybe we are the 20th lowest nationally, I think something that's also important to note is that when we look at our top jobs, half of our top jobs pay less than $20 an hour, right? And so you have a lot of people who are at this lower end of the threshold, and then many more families who are still below that 114,000. So really important to consider that when we talk about our advocacy efforts. A lot of policy decisions are made based on the federal poverty level, and what we're doing with the ALICE project and here in our state is really trying to lift up this ALICE data to say we need to do more, right? We need to look at these thresholds. We need to do more around a child tax credit for Connecticut families to help make more families be able to make ends meet and achieve that financial stability. So Stephanie also talked about the ALICE Essentials Index, which is a really useful tool, especially as we're trying to really understand the long-term ripple effect of the pandemic. We know that, many of the programs that were offered during COVID that have now sunset really helped families get by. And now this long-term ripple effect that we're seeing is that more people are struggling. Our job markets have changed. Families are facing a lot of new challenges, even though we're several years out of the height of the pandemic. And so this ALICE Essentials Index has really helped us with that, especially having 2 years of higher inflation. It was important for us to say, okay, so this is 2-year-old data. If we were to apply this to today, what do we think it would really cost for people to be making ends meet? So you can see that ALICE Essentials Index, when applied, represents a 13% increase, meaning that our families would actually need to be making in 2024, about $20 an hour for a single adult, $39 for an hour for an adult and a child, and $64 for that family of 4.
And I missed it. You may have had it on the heading. Is the federal poverty level, is that a 2024 number? Oh,
sorry. Yes, I was just going to go back. Yes,
it is 24. Yeah, I missed it on the heading.
So that is not updated as frequently, and so that is the more recent number that's being utilized. Yeah. Okay. So for more information on how we can take action through our local United Way to support families in Connecticut, I'm going to turn it over to Eric Harrison, who will talk a bit about our strategic direction, ways that you can get involved and join us in our effort to help people in the 860 region here in Connecticut. So Eric, happy to turn it over to you.
Thanks, Maureen. Good morning, everyone. Stephanie, also nice to meet you as well. I think it's the first time we've met. But for those of you who don't know who I am, I'm the president CEO of the United Way here for Central Northeastern Connecticut. And I am just so excited about where we are as an organization and where we're headed. And I think that, it's really rooted in the foundation of, work like this that's been done with the ALICE report for over a decade, and the work that Susan and Paula have done for many, many years with our volunteers and our donors. And so it's just exciting to continue to move all this work forward and really look at how we can make big, bold change. So as you probably know, we are celebrating our centennial year, and this is really an opportunity for us to prepare for a new strategic plan and a launch for that. And the ALICE data is important. It is data. And we also have data that we use with Data Haven's Community Wellbeing Index. So United Way is a co-sponsor of that, as well as the Hartford Foundation for Public Giving. If you're interested in that report, it is online. I do believe we have hard copies as well, but it's really great data as well. So if you're really into data, you're really into the numbers, and you really loved what you saw in the ALICE report and thought it was informative, I would encourage you to take a look at Data Haven as well, because it gets a little bit more granular here to the greater Hartford area. But we can't just rely on data alone. So as an organization, we wanted to be sure that the data was also paired with community voice, that we're rooting our strategic plan in community voice in addition to the data that we have. So we've spent the past 18 months listening to people in our community. Women of Tocqueville, I know, had some conversations, some roundtable conversations around this, reviewing the data, hosting design sessions with our community. And, you know, I just actually had lunch yesterday with one of our longtime partners in the housing and homelessness area. And one of the things he said that he appreciated most about the design sessions was we had partner agencies from every single issue area: housing and homelessness, child literacy, workforce, transportation, and health. But the interconnectivity of all of those agencies, that he said, you know, we work so much in a silo. We just see what we do every day. And he said, and that's what's really powerful about United Way, is that when you convene all of us together and we're able to see outside of ourselves, but yet we have this commonality as agencies, it's really powerful. And so I thought that was just very meaningful, and it made me feel good going away from lunch to say, you know what, we're on the right track. And as an organization, that convening role that United Way is very powerful as well, that we've really always had for many decades. But you know, to Stephanie's point, think big. And that's what we're doing. We're thinking big, we're being bold around our change in our region. And I really think that our new direction is going in the right way, and it will be very focused, impactful, and transformative. Go to the next slide, please. Ooh. So I know some of you have seen this, but our strategic plan was actually just released last fall. Actually, Natalie Morris was on that as well. She was part of the strategic planning committee. And so these are the real core areas for us as an organization, that we're united to end poverty, that we're claiming that, we're owning it as our signature issue as an organization. We're not shy about that. And that we're also expanding outside of just working poverty. So the ALICE report is largely in regards to individuals within working poverty, but we're also moving into extreme poverty as well, because we receive feedback from our agencies that that's something that has not been discussed as much as working poverty, and they would like it to be. And also, we looked at our investments over the years. So we shared data with the board that showed the investments that we've made with some of our partners in their programs. And there are many clients that fell into that extreme poverty level as well. That we're deepening community impact. That's about that bold vision to really look at accountability for improving measurable community education, health, and economic outcomes. And that equity is at our core. That the racial disparities that we see within this data are things that we're targeting, that it's very clear that those are areas that United Way would be investing in along with our partners. And really, you know, I think that fourth issue of operational excellence is really important. We've upgraded our systems, we've upgraded our financial systems, our database, a lot of our systems around just in terms of donor engagement and stewardship as well, and our policies. But we want to make sure that we're really leading an organization that's best in class and most relevant to current technology as well. Next slide. So this is the approach to the Onward 860 vision. And so you'll see two different things. You see United to End Poverty, the signature issue. And I think there's not, I think who has it? Sam? Oh, yeah. Or Sam used to have it. He must have switched their background. But Onward 860 was something else that came out of the community conversations, the strategic planning, is this unified region. It's that 860 that, you know, no matter where you live within that area code, we're all thriving to have the same quality of life. And so we want to make sure that that's something that we're doing throughout our 52 townships, and that's a goal of ours. So one way is aligning corporate, government, and philanthropic partners to end poverty. A lot of that's around our advocacy work as well. Actually, on Monday, we'll be doing a press conference with the governor. This is our second press conference with the governor around our rapid response funds. So these are funds that will go out to individual municipalities to divert individuals from falling into homelessness. So to pay a bill or a late deposit or late rent payment. So our utility payment, their utilities are going to be cut off. We really saw a lot of energy around this last year. And one of the things that was interesting, just in terms of looking at the region, was the first municipality to sign up for that rapid response fund was the town of Avon. So it just shows that throughout our region, it's not just about the individual needs of Hartford, but also other municipalities are facing the same exact concerns. So the data really matches what we're seeing on the ground throughout Hartford as well. And we want to leverage that 100 years. We want to leverage the expertise, the experience, the data, and the community voice and resources to deepen the impact. So again, leveraging that strong foundation that we have as an organization. And we want to connect people to resources and opportunities. Maura and her team do a great job with that. We want to continue to do that. We also want to look at when we have our corporate engagement opportunities that they're aligning with some of these issues that we're rallying around. So there's been a lot of as well. For instance, one of the projects that we did last year were home baskets for individuals that were individuals who were formerly homeless moving into new housing and partnering with some agencies in New Britain around that. So that's really exciting as well, that there's synergy between the volunteer projects and the issues that we're working around. And then just, looking at what are those game-changing solutions? How can we partner? How can we leverage with the government and other partners within the community, like Stephanie mentioned, to make bold change? So this is just a kind of a snapshot of formerly, or I guess present state, but also moving forward as an organization. So 2021, 24, we talked about this as a board. The organization had collective impact, focused on addressed broad community goals, education, income, health, and basic needs. And we had priority population, people living in households with wages up to the ALICE threshold, and focusing on measuring individual outcomes on the program level. So that's sort of current state, I would say, even as of last year with the organization. Moving forward, focus on ending poverty by reducing specific disparities. So really looking at that data and saying, where can we move the needle on these issues of child literacy, wages, housing, and life expectancy? And that we have a priority population that I mentioned earlier around working poverty and extreme poverty as well. And so with our partners, our goal would be to look at, what are those system level and community outcome changes that we could do? What's interesting is I had a CEO roundtable, I think it was about a year ago, with our top agency, our top funded agencies that, received the most funding from United Way currently and over the years. And there were about a dozen of them. And so my question that I posed to them was, what would United Way be to you? What would our relationship be if you did not receive any funding from United Way? No more funding. And they all said unanimously, advocacy. So I thought that was just very interesting in terms of our relationship, that despite whatever that funding relationship may look like, we're all united around advocacy and towards specific issues that we can rally behind. And also looking at, just kind of the way our funding went to agencies as well. There's one of our partners who has really, really, really good outcomes measurement software and things that they're working on. And so it was interesting that, we looked at, well, what would an unrestricted grant look like to that organization that we could use, kind of some of their technology and their systems, in addition to the programs, the great programs that they're doing as well. So kind of thinking out the box in terms of what that partnership looks like in the future. And then really co-designing those innovative solutions. So that goes, as I was talking about, where all the agencies were in the room. And so I know that we just received our report on that. Root Cause was the entity that we were working with around our community design sessions. We just received that report, and we're going to be diving into that a little bit more. I think that'll be released sometime in December or January more. I'm not sure what the time frame is, but we'll definitely share that with you. And maybe we could have that at one of the future town halls. All right, so lots coming up, lots of ways to get involved. If you want to join me for the press conference on Monday, you're more than welcome to. I know some of you are very interested in advocacy, so that will be the governor and Senator Farrar, I think, is she hosting it as well. And so I think that will be at the Legislative Office building, but I know Maura can send up more details around that too.
Yes, well, absolutely. We can include that in the follow-up email from today. But yes, it will be Monday at 1:30 at the Legislative Office building.
Great. We also have our Centennial Gala, and it's a really exciting time. I don't know that any other United Way has done this, Susan or Paula, but we actually have 4 of the 7 presidents attending the gala on December 14th. So I think that's just really exciting. I think it just really shows, the relationships that this organization has had and the strong foundation has had. So I'm really excited. You know me and Susan and Paula, but we're also going to have Dale Gray attending. He's going to be flying in from North Carolina with his daughter. So I'm really looking forward to meeting him. And there are some other, I know, past volunteers are looking forward to seeing him there as well. But lots of ways to get involved. Again, our centennial is coming up, and our Centennial Gala is coming up December 14th. We actually have a few folks from United Way Worldwide attending as well, that event. And obviously, I know Maura has mentioned this before, and Sam, but in addition to advocacy, we also have workplace giving or other types of volunteer engagement opportunities.
Thanks, Eric.
You're welcome.
So we will now turn it over to our newest team member, Samantha Gomez, to talk a little bit about some of the philanthropic opportunities that are available through United Way.
Excellent. Thank you, Maura. And I'd just like to start by saying thank you to everyone for being on this call. I know I've met some of you, but not all of you, and it's just such a pleasure to be here with you all and learn from you. And I did want to note too that I did love what Paula said earlier about this really being about purpose and values and all of us coming together for a common cause. I was doing a little bit of research in advance of this town hall this morning, and I did see something on the CT Council of Philanthropy that shared that 7 out of 10 donors say that personal values and beliefs are what lead them to support a specific nonprofit. And I think it's true that we're all here today because we care about our community and making an impact to change the trajectory for these Alice families. So that was just perfect timing with that one, Paula. I couldn't have set it up better. So if we just want to go to the next slide. Oh, this one, sorry, we're perfect. This one's perfect. I just wanted to highlight a couple of the giving ways, and some of these ways may be familiar to some of you, and some of them may be ways that you maybe haven't thought of supporting before. And there's a number of different things that we can kind of talk about offline if anyone wants more information. But I just wanted to take a few moments this morning to talk about some of these things and what they might look like. So of course, something that is really exciting to talk for me about is giving gifts of stock. And I think we'll hear a little bit more about giving from stock through stock in a moment. Susan might share a little bit about that with us, but I did want to highlight that. That's something that makes giving a little bit more accessible for folks and maybe something you haven't considered before. In addition to that, we have vehicles like donor advised funds that exist for the sole purpose of supporting charitable organizations that we all care about. So very often they offer tax-free growth, which can increase the impact of giving over time. They can also potentially lower your tax burden. So when you think about the right vehicles for you and what you're trying to accomplish, there's very often benefits to the donor as well. And by no means am I an expert on all of this, but probably many of you have someone that you work with your finances that would be able to guide you towards what the right giving vehicle might look like. On the next slide, we can talk a little bit more about some of the other ways of giving. Maura, if you could just go into the next one. I just also wanted to highlight the importance of things like workplace giving and how they've really set a wonderful foundation for the organization. It's been an entry point to supporting the United Way for many of our Tocqueville and Women of Tocqueville members. So some of our most loyal donors have started giving through small amounts through payroll deduction and now have grown to be some of the biggest supporters and advocates that we have. So that's something that we still work with our community engagement team on. If you work in a place that you think would be interested in starting a campaign, I'd love to connect you to our community engagement team, but I know also a lot of folks on this call are already very involved with that, and it's something that we continue to look to support the work that we do. And then also I just wanted to put in one final plug, which was that individuals who have raised their hands and made a commitment to support the United Way through estate planning are also an important part of sustaining the work that we do and into the future. And that's the 1924 Society, which honors these individuals. And that's just another vehicle to consider as you're thinking about your plans for your future. It's a great way to think about your legacy and the impact you might want to leave for many years from now. And it's a great way to include the organizations that you really care about and you want to see go on for many years to come. So on the next slide is just my contact information. I'd love to talk more with anyone who wants to explore any of these vehicles or talk more about their giving and what it might look like going forward. Again, thank you so much for having me here, and I'm just really thrilled to be part of this group and making a difference. And I think right now we're going to just pass it back to Susan and Paula for some closing remarks.
Great. Thank you, Sam. Thank you so much, Stephanie. I always learn so much when I hear you speak, and I want to thank you for your commitment to Alice over all these years, because I'm just such a proponent of this, and I wish it was more in the lexicon of people across the country, because it is such a great way of framing what's going on. What I've always loved about Alice is that it breaks stereotypes. And that to me was always the best part of it, that these people, most of these people are working. And, if you go back in history, one of the aha moments I guess I had, and I think many people do, is that, when I was growing up and Paula was growing up, and some of us on the call were growing up, you could work these retail jobs and cashier jobs and still make ends meet, and your kids could go to college because the hourly wage was keeping up. That began to change in the 1970s. So up until the 1970s, your wage, your hourly wage, you could support your family. That doesn't happen anymore. And some people are still thinking that's the case, and it's not. It's been changed for many, many decades. So I loved what you said, Stephanie, about all need to participate. There's a role for everyone to play. So, Maura, Eric, you've done a great job of talking about that, of leading our United Way to the old words, give, advocate, and volunteer. And I think those still resonate, that we can certainly advocate, and you've made it easy to do that. Many times where we get an email and it automatically directs us to our representatives, and we can support some of the bills and legislation that's going forward to help working families. And we saw how during COVID, those changes that were made to help working families brought kids out of poverty in Connecticut, and now it's all going away and it's all slipping back. How sad is that, when we make progress and then we step back? I also think that if people had paid more attention to Alice, or I guess let me put it this way. People did, when they voted, pay attention to the issues that are facing Alice, and you can also call Alice the economy. And that was what we've been hearing from the pundits, number one on people's minds. And again, United Way's been working on this for a long, long time and has seen this issue, and we framed it in terms of Alice, which I think was brilliant, Stephanie. So thank you. Before I move on from Alice, I could go on and on and on, because this is something that's near and dear to me and I'm passionate about. And I know Paula will laugh, but I would like Alice to become GAIL, GAIL, gained assets, income liberated. And, that's what I think we're all moving, so we'd have a different acronym to talk about, that we've moved an Alice to a GAIL. And that's really what I think we're all focused on, and it certainly makes a lot of sense in our community, in one of the wealthiest states in the union. Look at how high the percentages of Alice families. It's something that we all need to take into consideration. And last, Eric, I love what you said about interconnectedness. That was something that Paul and I also always talked about. And when I'd go out and speak, I'd say no one agency can make a difference all on its own. It is all interconnected. And I think that is so important to talk about and bring out when you're out speaking. They all mesh together. It's not just about homelessness. It's not just about education. It's not just about hunger. It is all pieces of a puzzle that need to be worked on in a very holistic, collective impact model. And thank you, Eric, for recognizing that and moving forward on that. And please, I can see the centennials there. I'm looking forward to going. Yes, there'll be 4 out of the 7 CEOs. And for 100 years, 7 is not very many, is it? CEOs. And I just want to say, I think it means you live longer if you're a United Way CEO. So good luck, because Dale is 90 years old and he's going to be coming to this. So very excited to see him. And then lastly, give, advocate, and volunteer. Give is number 1. Paula and I have been very fortunate that we have been able to continue giving at the Tocqueville level. I remember when I was thinking about retirement, I talked to the staff and said, don't count on me for a Tocqueville gift. Not sure I can do it. But literally, because of stock giving, and I think Paula has done the same thing, we have been able to stay at a Tocqueville level because we do have appreciated securities. And now that I'm old enough, I will have to look into the IRA also, my account, my Roth account, and see if that might be an even better way for me to give. But there are many avenues for giving. And Paul and I have also done the donor advised fund, which is another great way to give. So there are just so many vehicles to make it easy to continue your support for our United Way. I think I've said more than enough. Paula, have I left some time for you?
So, I have a financial advisor, and then I have Susan as a financial advisor in addition. So following her lead, I also have been doing what I consider my blended gift to my local United Way. So annually, I continue to be a Tocqueville donor, and I am giving a gift of stock. Don Allen may or may not be interested in this, but as a kid who grew up in New Britain, where any number of relatives worked at the old Stanley Works, getting a share of stock was a big thing as a present. Well, there was no cost basis for that. And so that was a wonderful way to make a contribution through gifts of what is now Stanley Black & Decker. The donor advised fund that United Way set up, it was very intentional so that a portion of whatever is placed in the United Way private label DAF is restricted to United Way. And you can designate it to any one of United Way's great initiatives. And another unique feature is that that money in that donor advised fund grows because you can pick how you want it invested. The way in which I am a member of the 1924 Society is that I have made provisions that upon my passing away, my donor advised fund resources go to United Way. It will not be administered by a beneficiary. United Way will be getting the gift. And I hope that as I continue to contribute and use the DAF as that vehicle, that will grow. My point in all of this is there are many ways in which we can add the fuel, the financial fuel, to our passions and to the causes we most care about that are in alignment with what our local United Way is tackling. And I just encourage people to find your passion and fuel it philanthropically, fuel it through your volunteerism, fuel it through your voice. Hugely important. So we hope that you enjoyed today's presentation. Would really welcome feedback from our leadership donors as to how did you like it, and are there topics that you would like United Way's Women of Tocqueville to present in a future town hall, all in alignment with what our United Way is doing and is pursuing and how we move forward. So please let Susan and I know, let the staff know. We welcome your feedback for future topics and how today went. If you want to know anything at all about United Way's membership programs, or ways in which any one of the giving options available to you, Sam, wave at us. Sam Gomez is our go-to. So thank you, Sam. Also give Sam a shout out. Like me, she's a New Britain girl. You go. Okay. So thank you again for your commitment. We hope to see you at the Centennial. Let's all celebrate and let's renew our commitment to moving forward. Thank you. Thank you to the staff for putting this together.